Hello everyone, my name is Tru Kwong and I'm doing my presentation on human papillomavirus or HPV. HPV is a virus that infects the surface of the skin, mainly in the genital area where warts can appear. Some HPV types can even cause cervical cancer if left unnoticed. So why is this disease considered a public health problem and why does it even exist in our society? Well, there are more than 130 types of HPV with vaccines only for a select few. With the rise of the anti vaccination movement, children are not getting the necessary vaccinations they need to prevent diseases that are otherwise avoidable. Furthermore, the HPV that causes cervical cancer are usually silent, meaning that infected women show no symptoms and are often unaware they have the disease. Many people with HPV do not know they have it, which is why the spread of the disease is so rapid. How the disease happens. The virus is transmitted through sexual contact, whether it's through vaginal sex, anal sex, oral sex, or genital touching. The scary part of HPV is that even if there's no penetration, the virus can still be transmitted. Furthermore, HPV can be found on regions not on the genital area, such as the inner thighs or the scrotum. So even with the use of a condom, no one is completely safe. Another way the disease is transmitted is from mothers to their children. So, with that being said, pregnant women should get screened for HPV early on in the pregnancy. Where the disease occurs. There is no specific region of the world that HPV is prevalent in because it is everywhere. It is global. With over 70 million Americans affected with this disease, one can only imagine how many people in the world have HPV. This disease can be found on the surface of the skin and even on hair. Ethological factors. No one group of people are susceptible to this disease. Men, women, adults, teens, children born from HPV infected mothers, people living in developing countries, and people living in developed countries are all able to get this disease. The future risks for the community are that the virus continues to spread rapidly and perhaps mutate and form deadlier strands. How to solve the problem. One solution could be to implement more preventative measures, such as getting tested if you're sexually active or getting vaccinated. By getting tested, you can prevent transmitting it to your partners and spreading this disease. And by getting vaccinated, you prevent even the virus, thus limiting the spread of the disease. The second solution that can be implemented is to practice safe sex. What I mean by this is that you should always wear a condom and have few sexual partners. If you do have the disease, then you should be open about it to your partners and tell them so you can prevent the spread of the disease. Some examples of nations that solved this problem was the United States and the United Kingdom. In the US, HPV is the most commonly sexually transmitted disease with roughly 79 million Americans infected. HPV is so common that 80% of sexually active people contract it at least once in their lives. In order to resolve this, some states have taken preventative measures such as requiring the HPV vaccination for children in secondary school. For example, states like Rhode Island and Virginia currently require the vaccine. As a result of this, their HPV infections have decreased. Another example is in the UK, where HPV used to be the most commonly sexually transmitted disease. But in 2009, vaccination for the disease began, and HPV has jumped lower on the list of the most common sexually transmitted infections in the UK. Public health in the future. So, what are researchers saying we should do about it? In HPV and cervical cancer prevention counseling with younger adolescents, implementations for primary care, researchers emphasize that primary care physicians need to counsel adolescents on preventing HPV and cervical cancer. Furthermore, they urge that these adolescents need to take preventative measures such as getting vaccinated. They hope that educating teens on this manner will influence them to act in a more responsible way and prevent getting HPV. My personal opinion is that HPV vaccinations should be required in every state because this could save millions of lives by preventing people from even getting the disease. I also think that the medical field should be more open about HPV and conduct more aggressive campaigns to educate the human population. HPV is so common because many people don't know what it is. If people knew about HPV and all the risks that come with being infected, then they could prevent themselves from even getting the disease, or if they have the disease, they could prevent spreading it to their partners. Solving the HPV epidemic is a community effort. And these are my references.